thing is over. When are we going to stop your hyperbaric oxygen? Yeah, whatever treatments we are giving. And I left this patient like this only. Maybe he might have gone to some other person and think like that. I had scores of diabetic foods as such, where we got some healing. This was an interesting case. This was a engineering student. She got aorta arthritis and she had a imminent gangrene, and everywhere they told to go for some kind of amputation only. And we started this therapy, and there were a lot of things. I just want to this one. Everything is there on website, and this was the result we got it as such. Still, we are working with this girl. She comes once in 3 months with us, and I was able to treat this Takayasu disease with all inflammation. All thing is gone now, sir. So the thing is, what I was trying to work out is, here is a important thing. For all these patients, I did do some treatment which was out of box thinking. There is a thing called ozone. I did something like chelation therapy. I started thing when there was a TSCT trial was going on. I was also a part of TSCT trial. This was done for. So the result of TSCT trial was mind-boggling. We never expected this kind of result. The thing is, this TSCT trial result gave a thumbs up thing for patients who are diabetics. The patients who are diabetics, who had a MI and all that, they do phenomenally well when they go for a chelation. So the take-home point I was trying to focus is, these are the people who has microangiopathy. The people with microangiopathy, they do very well with chelation. That was the thing which was agreed by a lot of people. And there is in diabetic, this study is still on the, people are looking into, it's a landmark study, sir. With this study, we are doing almost all cases, chelation and other stuff. And this is, after that, I started doing something called hyperbaric oxygen. I became inquisitive. I thought I'll try to help out some autistic and other things and all that. And we started doing hyperbaric oxygen. I just give a brief what we are doing with hyperbaric oxygen. We are increasing the pressure of oxygen when, that's it. We are not doing any major, there's no hi-fi things as such. It is just a chamber where it's a Coca-Cola principle basically. You are increasing the oxygen perfusion into the blood by increasing the pressure as such. I'll just go very brief, fastly. And as you can see here, okay, this is before and this is after HBOT. This is what arterial oxygen content as such. And I'll just show you. This is one side. This should be the 1 second. Colors are not very clear here. This is the hemoglobin is this much before, and this is the kind of arterial oxygenated hemoglobin here. The thing is, it is increasing the hyperbaric oxygen. We are just improving the perfusion in the lungs, and as you can see here, from the lungs, the increased oxidation here goes into tissues, and from it tissues. Oxygen is carried not only by the RBCs, it is carried by the plasma as well. In cases of brain and all that, we have seen the oxygen is carried more in the CSF also, synovial fluid also. You don't require a RBC for that particular thing. That is the kind of thing, as Ankit was telling. You have to make things into proliferative zone. By hyperbaric oxygen, we are able to make it on almost all cases. The clinical implication, the moment we see the non-healing ulcer, we do 10 sessions of hyperbaric oxygen, sir. We can see the lot of granulation. The patient is happy, we are happy. The moment granulation appears, that is the kind of proliferation thing as such. I was somehow I don't understand logic in US. The logic was very clear. Hyperbaric, there are approved conditions and there are off-label conditions. approved conditions are only for insurance purpose. If you want to go for that therapy and you want to take you have to claim, then you have to go in the approved thing only. And if you go for unapproved conditions, you will not get any claims and all that. Most of us here, we don't know that particular thing. But off-label indications, I saw a gold mine, sir. I am treating cerebral palsy patients. Cerebral palsy is getting better. I am working out with multiple sclerosis. Multiple sclerosis, we have seen the kind of difference what we are able to work it out. Regional pain syndromes, trigeminal neuralgia, it goes like you have 10 to 12 sessions, we can make a difference of trigeminal neuralgia. I can go on and on, sir. We are working on stroke basically. The patients who are chronic, this also, hemiplegia, they can see the difference as such. Cancer, there is a lot of work on cancer, metabolism of cancers. We are seeing in the breast cancers how it is evolving as such. We have to go at the cellular level to find out the thing as such. Myocardial infarction, there are a lot of work which is done. The immediate thing, if somebody suffers myocardial infarction, if you give hyperbaric oxygen, you are limiting the size of the infarct. The scanning and all that, then you are trying to reduce that particular thing, sir. Autism, we have done a lot of things, sir. I don't want to mix into that, but hyperbaric oxygen, it is activating 8,000 plus genes as such. It is regulating the inflammation, it is down-regulating the inflammation, up-regulating the growth and repair process. It's basically, somehow I felt this is, if you have excess oxygen, yes, it is a plus point, and now we feel that all wellness, we want to look young or we want to do some things and all that. Sometimes at the end of my day, I just go into the hyperbaric oxygen and I feel refreshed. It's a very simple way of, and I know this is a very simple way of activating stem cells. Your stem cells are 8 times more after at least 20 sessions of hyperbaric, sir. You want to, I'm sure you will not require stem cell therapy. You can as well join this particular thing. This is what exactly I want to just show. Lights. See, in case of brain infarct, see, there is a thing called dead cell and there is a thing called normal cell. In this one, there are some set of cells which are hypo. They become dormant actually. There is a zone of on MRI or CT we see a black thing which is the infarct. Periphery cell. Along the periphery, you have number of cells which are lying in a state of pulse. There lies the answer. The patient starts moving the hand. No amount of physiotherapy is going to. Maybe physiotherapy also is useful, but somehow that makes the thing. We are just reactivating this place. We are trying to. Dead brain cells are the black spot. We are not concerned about that. But the sleeping brain cells, if we are able to wake them up, we make a inroad, sir. And as Ankit has told about mammography, I'm sure it's going to change the way we are practicing and what I was telling you. It's definitely a screening procedure, and there is no radiation involved. There is no pain. We have seen. I was there in CDR in 1993, 92 as a radiologist. I joined as a first kind of thing after completing my Osmania thing. I joined as a thing. My seniors, VSV Ramon, used to do mammography reportings. We were not allowed to go for that. We used to have an ultrasound kind of thing. But I never understood what was it going as, sir, because we gave a lot of false positive cases, and there were cases which were the hospital has to pay with the cases as, sir. What I'm trying to tell is that normally, when we are looking at X-ray mammography, in Asians per se, you have got a fibroglandular abundant pattern. You have got density of the breast is high. You cannot image with X-ray mammography. You get a lot of false positives. And here there's a modality where we can. So when we saw Ramon and other people working, we used to understand with every mammography, X-ray mammography, they used to look at high resolution ultrasound, not came that time. 1993 there was no high resolution ultrasound. Later, when I was in Vijaya, we understood the ball and game. Every report we used to give, we used to check with high resolution ultrasound. We used to see whether there is a thing. We used to look at some parameters, sir. We used to look at the calcification, lesion taller than wide and all that. We used to check it out. And we used to do, okay, probably carcinoma for however advised FASC and further evaluation. That was the kind of defensive practice we used to do. But I somehow feel here is a modality. You can pick up cancer before the formation of a lump itself. I think that is a very easiest thing as well. And we went on working on this particular thing, sir. And I somehow feel it's not a pinch on this one pocket, and it's a very simple thing as such. I can always enter into one more this one, but time is not going to permit me. And any question answers and all that, we'll be definitely happy to answer. Satish, thanks for coming. I must acknowledge all of you. Dr. Ramkrishna Satpalkar sir, he is a teacher, and Suniti madam, UP Mishra sir, madam, Vimal Bhai sir, thanks for coming all the way. He is now into all teaching, and Rekha Gupta madam, Tahe Dil Se, Sir Gupta sir, Mukesh Bhai, everybody, and R.K. Gupta, he is a Apollo surgeon as such. We will definitely take some questions, and or we can join for a dinner and take questions there itself. I can always, अभी तो बहुत serious session होगा. I can always put some jokes and all that there. Dr. Buddha, you have anything to say? You want to share your case? What you had? And somebody was telling they want to come and say something. You were telling. You want to tell something? No. Where is Ankit? Yeah. You want to answer any questions? You have some questions? You have to have questions. I think we will go break for a dinner, sir. बहुत late हो गया. Yes, ma'am. Autism is a big thing, ma'am. I think I can always go back to this particular thing. This is what happens. In autism, there will be hypoperfusion always. Hypoperfusion of temporal lobe, particularly on the left side, and the corpus callosum right to left, there is a kind of thing. Hypoperfusion. In so many things, not just autism, for schizophrenia, hot रहता, गरम रहता उसका दिमाग. जरा बोलते ठक working on. These are the ways it works, madam. Or the best thing what I have picked up in autism is the mitochondrial function improves. Once the mitochondria, I can always pass this slide always. This is what exactly happens in autism. I'm happy you asked about autism, and it's good that somebody knows. I'm here because of autism. I had whatever practice I was a radiology. I practiced in started from CDR, worked in Vijaya, then I was in Apollo, then I started my own venture. Then I I still do my aspirations and FNSCs, ultrasound guidance, but I don't do routine radiology. But now I'm here, I think that I want to integrate normal radiology to this functional this one, and we can definitely make a lot of things. I was telling about out of box things. We will not probably require a. I don't want any ENT surgeon is not here, no? Sir. We can always do a sinoscopy, endoscopy without any machine. What we'll do is we'll just give a steam and we image with this thing. We can image the whole thing, sir, frontal, maxillary, and all that. So just a kind of work as such. And I'm sure you are very open, sir. Dr. Vimal Bhai, sir, you have any? Sir, Mukesh Bhai.
I'm Dr. Mukesh Raj. I had a problem you know that I had a CVA. I went into hemoptysia and I was not recovering. With about 20 sessions of hyperbaric oxygen, I had a tremendous improvement in my functional capacity. And Dr. Praveen was taking care of me. Really, really good.
He, in fact, we were there at when he had a hemorrhage, and all was told ki nothing and all that. I feel God is great as such. And Mukesh bhai, I kept telling him he was going for physiotherapy. And I think after 2 years you came, sir. He did a hyperbaric. I am sure that the sleeping cells, if we can improve 20% also, it makes a difference. Yeah. Thank you, sir. Doctor, you have any questions? Yeah, Dr. Sridhar.
I would like to know what are the neurotransmitter abnormalities that can be made better?
Sir, what are the neurotransmitter abnormalities that can be made better?
Neurotransmitter abnormalities, sir, I don't know that segment at all. The thing is, neurotransmitter abnormalities are basically dopamine, acetylcholine, and that particular stuff. I have not gone into details as such.